Ciao, benvenuti al mio canale. Come promesso, in questo video ci sarà un'altra persona che parlerà dell'equilibrio acido-base nei cavalli con esempi pratici. Se avete perso il video precedente lo trovate nel link qui in alto. Questa persona è Judit Viu. Lei ha studiato e ha lavorato per diversi anni all'Università di Barcellona, dove ha anche fatto una residency in medicina interna equina e un dottorato sull'equilibrio acido-base nel puledro e nel cavallo da endurance. È quindi la persona più adatta per parlare di questo argomento. Il video sarà in inglese, ma ci saranno i sottotitoli in italiano. Se vi piace il video premete mi piace. Se vi piacerebbe vedere più video come questi con collaborazioni e diverse persone spiegando diversi argomenti, commentate il video. E anche se vi piace questo nuovo stile di video più interattivo, per favore lasciate un commento. E ora vi lascio con Judith.
Hi to everybody, my name is Judit Viu and I'm going to present you a couple of clinical cases to practice the interpretation of acid-base balance in horses. First of all, we are going to remember the steps to follow for the interpretation of blood gases presented by Valentina in the previous video. The first step is look at the pH that appears in our gases. If pH value is decreased below the range 7.38, is called acidemia, and if the pH is increased outside of the range 7.45, is considered alkalemia. The second step is to evaluate the respiratory component of the acid base. The gases that you are going to see later are venous gases, therefore the reference values are slightly different, especially in the oxygen and pCO2 concentration. Taking into account the venous origin of our samples, we will look at the pCO2. If the value is below 45, the horse has respiratory alkalosis, and if we have a value above 65, the horse has respiratory acidosis. The third step corresponds to checking the levels of base excess or bicarbonate. Even if this belongs to the traditional method, can help us detect metabolic alterations because traditional method is more descriptive than mechanistic. The fourth step corresponds to checking and calculating the effect of electrolytes on the pH. As Valentina explained in the previous video, in the quantitative method we have three independent variables. One of them, pCO2, it was checked in the second step, but it is necessary to assess the other variables. The strong ion difference, or SID, which corresponds to the ion effect on pH, and a thought that corresponds to the influence that proteins have also on pH. The main alteration will be caused by changes in strong ion difference and not in the A thought, because A thought have very little influence on the pH, and only few cases in which there are a huge hyperproteinemia will have a significant influence on pH. So we recommend not calculate it except in cases where there are alterations in proteins. If you have to calculate it, the simplified equation is the product of total protein and 2.24 for adults or 2.5 for foals. The strong ion difference calculation, that is our main metabolic influence in pH, as mentioned in Valentina, may or may not include lactate, and its formula is the following one. This value in horses must be between 38 and 45. We can divide the alterations into acidosis due to a decrease in strong ion difference caused or not by hyperlactatemia, and alkalosis due to an increase in strong ion difference. Finally, last step is look for primary alterations of the pH and which changes are compensations. Most typical compensations are made by respiratory system, but in rare cases could be also metabolic changes to compensate the pH. Ok, Okay, the first clinical case that we are going to present corresponds to a 24-hour-old female Frisian crossbred named Macarena. Foal was referred to the hospital with history of progressive weakness and flexor tendon retraction. And here are the blood gases of this case. The first step is look at the pH. In this case, the pH is 7.42. It is at the upper limit of normality, but still normal detected. The second step is look at the PCO2 to assess the respiratory component. In this case, it is 34.9, below the lower limit of normality. Therefore, Macarena has respiratory alkalosis. The third step is look at the base excess. In this case, it is equal to 0. Therefore, they are within the normal range of normality. In case that we only interpret the blood gases based on the traditional method, no metabolic disturbances are detected. But it's important to remember that it's possible to have metabolic alterations without base excess changes, and that happens in this foal. The fourth step is look at the electrolytes, lactate, proteins, and strong ion difference in ATOT. This foal have a huge hyponatremia with hyperkalemia and mild hyperlactatemia. Now we can calculate the strong ion difference. The strong ion difference value is clearly decreased due to marked hyponatremia, partially masked by the increase in potassium levels, and on the other hand, we can also calculate the ATOT. There is no significant alteration in ATOT. Therefore, the foal has metabolic acidosis due to decrease in strong ion difference, with slight increase in lactate, and the main cause of this acidosis is the decrease in sodium levels. Could be something more? The graphical presentation of the electrolytes and positive and negative charges is called gambelogram. This graphic presentation could help us to see if there are any alterations in unmeasured ions, because there are a difference between the positive and negative charges. In our case, the positive and negative charges are more or less equal. This leads to interpreted that there are no changes in non-measured ions. In summary, the alterations of acid-base balance in Macarena are the following ones. We have a normal pH with a compensatory respiratory alkalosis and marked acidosis due to decrease in strong ion difference levels. This decrease is due to the hyponatremia and mild hyperlactatemia, but is also masked by the increase in potassium levels. The main problems in this foal is this hyponatremia and this hyperkalemia. It's important to identify the cause of decrease in strong ion difference in order to apply the right treatment. In this case, it's also important the way of correction of these alterations, because when we have a very huge hyponatremia, the correction of sodium levels too fast can lead to neurological lesions, and high levels of potassium can lead to cardiac arrest. These alterations in electrolytes are very typical of two different pathologies in neonates. One of them is the urabdomen, and the other one is a massive myositis that, for the age of the foal, the most probably cause is the nutritional myopathy or white muscle disease. In both cases, very marked hyponatremia goes together with hyperkalemia. Therefore, the biochemistry should be completed with muscle and kidney profile. In case of Macarena, we have values of CK and EST extremely high. Based on these results and the story of the fall, we can reach the diagnosis of congenital white muscle disease. In the following table, you can see the evolution of the electrolytes until practically total normalization and also the values of a strong ion difference. The second case is a male of 9-year-old Arabian horse called Said, presented 24 hours after finishing a 120 endurance race at very high speed. After the event, the horse was dehydrated and had synchronic diaphragmatic flutter that improved with fluid therapy. After this initial treatment, the animal was transported back to his stable, and the following day, the horse was markedly depressed and had tachyarrhythmia and muscle pain on palpation. And here you can see the results of blood gas analysis. First of all, we are going to check the pH. In this case, the pH was 7.192. This pH is clearly below the normal range, so we can say that Said has marked acidemia. The second step is check the PCO2. In this horse was 28, also well below its expected value. Therefore, with respect to respiratory component, the horse presents respiratory alkalosis. In the third step, we look at the base excess. In this case, it's also below the normal value. This indicates that we must look for a metabolic alteration that causes acidosis. In the fourth step, we can identify the cause of this acidosis. In Said, we can see that the cause of this acidosis probably is the hyponatremia with hyperlactatemia. There are also present a hypokalemia, but it's very mild. To complete the interpretation, calculate SID. Strong ion difference is decreased below the lower normality limit due to the hyponatremia and hyperlactatemia. This leads to a strong ion difference acidosis. We can also check the proteins and calculate ATOT. Of course, there are no changes in ATOT because there are no changes in proteins. All the changes that we can see in the pH is due to the decreased value of a strong ion difference. Could be something more. This is the gambogram of Said, and there are no big changes between positive and negative charges. Therefore, no important alterations are present in non-measured ions. To sum up, Said present marked acidemia, compensatory respiratory alkalosis, marked metabolic acidosis with decrease in a strong ion difference, and this decrease is due to a lactic metabolic acidosis with hyponatremia and mild hypokalemia. The main problems in this horse is the hyponatremia. Said has marked alterations of the muscle enzymes, myositis, and ventricular tachycardia with severe myocardial damage, and it also diagnosed it after examining it with hyperammonemic encephalopathy due to colitis. Finally, one extra comment on this case. When we face cases of colitis, there can also be a loss of albumin. These losses could be important enough to influence the pH, especially if the levels of proteins decrease below 4.5. In these cases, we recommend calculate ITOT to know the influence of proteins in our pH. If you find useful this video, press like, and if you want to see more educational videos about acute internal medicine, subscribe to Valentina's channel. Thanks for watching.